Welcome to True News, observations and commentary on the current world state of affairs, including politics and the economy. We try and highlight the interesting pieces of news that may not always be so mainstream, and try to connect some of the dots to make sense of it all. Today we are looking at the shadow pandemic. From this article in the New York Post, many who survived the virus just couldn't handle the new normal of quarantines, lockdowns, record unemployment. The fear of the unknown, the loneliness, the anxiety, the isolation, the sense of dread, the worry of will this ever end? This is the mental health shadow pandemic that accompanied the viral one. Many psychologists are calling out the ongoing mental health pandemic. Depression among teenagers is widespread. They can't cope with the lockdowns. And there's no consideration for their mental health coming from any politicians or those pulling their strings, like Klaus Schwab and Bill Gates. From this page on the Mayo Clinic website, the Mayo Clinic has warned, during the coronavirus disease 2019 COVID-19 pandemic, you may experience anxiety, fear, frustration, sadness, and loneliness, to the point that those feelings become constant and overwhelming. Existing mental health conditions, including severe anxiety and major depression, may worsen. If you're feeling hopeless and having thoughts about suicide, or you're concerned about someone else, learn how to find help and restore hope. Oh gosh. The National Library of Medicine also wrote on the subject. Multiple lines of evidence indicate that the coronavirus disease 2019 COVID-19 pandemic has profound psychological and social effects. The psychological sequelae of the pandemic will probably persist for months and years to come. Studies indicate that the COVID-19 pandemic is associated with distress, anxiety, fear of contagion, depression and insomnia in the general population and among healthcare professionals. Social isolation, anxiety, fear of contagion, uncertainty, chronic stress, and economic difficulties may lead to the development or exacerbation of depressive anxiety, substance use, and other psychiatric disorders in vulnerable populations, including individuals with pre-existing psychiatric disorders and people who reside in high COVID-19 prevalence areas. Stress-related psychiatric conditions, including mood and substance use disorders, are associated with suicidal behavior. COVID-19 survivors may also be at elevated suicide risk. The COVID-19 crisis may increase suicide rates during and after the pandemic. Mental health consequences of the COVID-19 crisis, including suicidal behavior, are likely to be present for a long time and peak later than the actual pandemic. This is the problem when politics gets involved in medicine, because no matter the truth, the politicians cannot now admit that they are at fault for adopting lockdowns. There has been a dramatic rise in the number of people contemplating suicide. From this NPR website, suicide is complex, involving layers of risk factors, including biological and environmental ones, and it's hard to know the exact factors involved in the deaths of these 19 students. But the sudden rise in deaths has school district officials worried that the coronavirus pandemic may have played a role. And educators and mental health care providers in other parts of the US have the same problem. In recent months, many suicidal children have been showing up in hospital emergency departments, and more kids are needing inpatient care after serious suicide attempts. You see, teenagers see their future gone, and over 3 million of them have actually dropped out of college. Many adults have lost everything from their employment to the idea of even retiring. Even people in the airline industry, banking, and hospitality have lost their futures. Waitresses have lost income and have been unable to resume school. The destruction unleashed by our so honorable politicians who impose restrictions to please those pulling the strings from above is not beyond belief. These career politicians who have championed the lockdowns are engaged in more than just corruption and greed. They are engaging in the destruction of our civilization and crimes against humanity. Have we simply replaced the king with ministers who vote according to the highest bidder? Something to think about. Thank you for listening to True News. Please subscribe for regular updates and click the like button.